During this video you will be given a basic overview of some of the issues which you may be currently experiencing in regards to your bowels, with a particular emphasis on constipation and some tips on how to improve these symptoms. Constipation affects between 5 and 20% of the population, with women being twice as likely to have symptoms as men. Of those women, both pregnancy and older age can influence the likelihood of having symptoms. Normal bowel habits can range anywhere between going 3 times a day to 3 times a week. If you're somebody who opens their bowels less than 3 times a week, we would class this as having constipation. Many women who struggle to open their bowels more than every 1 to 2 days may not be constipated, but rather may have symptoms of pelvic floor weakness or pelvic floor incoordination, dehydration, lack of fibre intake, making it difficult to have a poo. Using the Bristol stool chart, which you can see on this slide, will help you identify which number most closely resembles your bowel movements. This will help to give you an indication of whether your diet may be lacking in fibre or fluid. Establishing a daily bowel routine is important to try and get your gut moving regularly. This means eating breakfast daily along with a hot drink. Approximately after an hour of having your breakfast, go to the toilet even if you don't have the urge to go. The way in which you sit on the toilet is important to help in having a satisfactory poo. Sitting in a squatted position is the most natural and effective way to poo, and you can see an example of this in the picture on the slide. You can do this at home by placing a step of some kind under both feet. You might use a small step, an upturned washing up bowl, a pile of books or magazines, or even a toilet roll under each foot. Make sure that your bottom is sat on the toilet seat and you're not hovering. This allows your pelvic floor muscles to relax. Then lean forwards and rest your hands or your elbows on your knees and take some nice relaxed breaths. Using the following technique will help you to avoid the need to strain. As you breathe out, bulge the tummy outwards and feel your waist widening as you push pressure downwards and backwards into your bottom for the count of 3, and then relax. On your next breath out, repeat this. It should feel like a slow pumping action as you push and then relax and push and relax. And this is what we refer to as the brace pump action. And again, it helps to avoid the need to strain when pooing. An alternative to this is to say the word mooge out loud. Saying this word helps to create the same abdominal bulge and waist widening. At the same time, push downwards and backwards into your bottom for the count of 3, then relax, take another breath in and repeat the word mooge again as you push downwards and backwards into your bottom. Try not to sit any longer than 5 minutes on the toilet and avoid straining at all costs. If you haven't been able to open your bowels, leave the toilet and try again the same time the next day. This is usually best after having a warm drink and a meal, or the next time you get an urge to have a poo. Remaining fit and active is not only important for your health and well-being, but also in assisting with regular bowel movements. Your bowel is stimulated by eating regular meals, good fluid intake, and movement or physical activity. So aim to drink around 1.5 litres of fluid per day and avoid skipping breakfast. And aim for 30 minutes of physical activity per day. Some foods contain natural laxatives and can easily be added to your diet to help with bowel regulation. Such things as eating more fruit and veg, particularly dark leafy vegetables like kale, cabbage or spinach. Flaxseed can be added to cereal, yogurt or smoothies. drinking plenty of water in line with any advice you may have been given regarding fluid restrictions and bladder retraining, eating dark chocolate and natural licorice, natural yogurt with probiotics or probiotic drinks. As a result of being constipated or struggling to have a poo, some of you may be experiencing hemorrhoids. These are small engorged blood vessels which come out of the bottom on pooing, or sometimes with a great deal of pressure like straining or heavy lifting. For some they can be uncomfortable and bleed. The best line of treatment is managing your constipation with the suggestions mentioned earlier in the video, such as diet, fluids, positioning when pooing, avoiding straining and sitting on the toilet for long periods. Other topical treatments include anusol or germaloid cream or suppositories, or some find the use of witch hazel helpful. Your local pharmacist or GP will be able to give you advice on further topical treatments and how best to use them. It's important to remember you're not on your own. Many women experience symptoms of constipation at some time in their life. Make sure that you establish a good daily routine to help with regulating your bowel movements. Ensure that you eat breakfast and regular meals at regular intervals and a warm drink every morning. Maintaining a good fibre and fluid intake will ensure your stools remain soft and easy to pass. Remain as active as you're able to. Remember, a sedentary lifestyle will lead to a sluggish bowel. Try to include foods in your diet which act like natural laxatives, as these will help to encourage and stimulate more regular bowel movements. At all costs, stop straining, as this is not only effective at helping with bowel movements, but it will also put a lot of strain on your pelvic floor muscles, and this results in weakness and the risk of prolapse and hemorrhoids. Treat any obvious hemorrhoids with topical treatments, but if you're unsure, obviously ask your GP or local pharmacist for any more information and advice. We recommend that you follow and implement the advice in this video for the next 2 to 3 months. Should you still have ongoing symptoms of constipation or any difficulty with emptying your bowels, please get in touch with us here and the Women's Health Physiotherapist will be able to help you further.